first event of the academic year for Global Classroom for Health Profession Educators Network. I have added the website for this one in the chat. Please have a look about who we are and what we would like to do here. And as part of this kind of like a global event, I'm very happy to see that we have around 62 people signed up for this event who are from different parts of the world. We have people from UK, Ireland, we have people from Turkey, from North Macedonia, India, Malaysia, Indonesia, and Saudi Arabia. And of course, maybe there are a few more which I have missed, but it's fantastic to see that people around the globe who are interested in this topic can come together and have a chat about what we would like to do, because at the end of the day, healthcare professionals should be able to work across many countries, not having that consideration for borders. And this is what we are trying to achieve here. I'm Vrinda Nayak. I'm an associate professor in medical education at the University of Exeter Medical School. And I'm also Associate Dean for Taught Students, Racial Equality and Inclusion for the University of Exeter. I worked with our founding members who are Amani from Saudi Arabia, Joe Matahan from Malaysia, and Winnie Nino from Exeter, and Junji Jim Lim from now from Newcastle, Elsa Sanota B. Devi from Manipal. We came together and we started this Global Classroom for Health Profession Educators Network, or for short GCHPEN, and we have created resources for people to learn about how to host virtual exchange events for health profession students and how to embed that into their curriculum and education practices. As this is our first event for the academic year, and the title of that event is Virtual Clinical Experiences, High Quality Teaching and Learning from Clinical Teaching. So this is the presenter is Gideon Shimshon, and I'm going to give a very brief introduction to Gideon. I met Gideon maybe a couple of years ago now, where I learned about the work he's doing with one of our professors at the University of Exeter. It's really mind-blowing, and I really enjoyed listening to the work that they're doing. So Gideon Shimshon is the co-founder and chief executive officer of the Global Health Education Group, or GHEG, which develops virtual clinical experiences platform. It is a secure and scalable infrastructure that connects students to real clinical encounters across borders. Gideon is a former director of digital learning and innovation at Imperial College London. He has led global programs reaching more than 1 million learners now. He has advised governments, multilateral organizations, and leading universities on advancing digital innovation and transformation in higher education. His current work investigates how technology-enabled and blended models can increase clinical training capacity, drive educational excellence, and strengthen the global health workforce. So thank you, Gideon, for accepting this offer and coming here to give this session. I will hand over it to you now, but before you start, I just want to tell the participants that we are recording this session. We'll make sure the recording is only Gideon's presentation, so please feel free to ask any questions, and we'll make sure those conversations are not part of the recording. Thank you.
Thank you. Thank you for the really kind introduction, and I hope I'm able to deliver on that intro. Thank you for having me. What I wanted to share with you today is essentially a little bit about our journey and what we developed, and really get your take on what you see here. Let me start by sharing my screen. I hope you can see this. Can everybody see my screen? Fantastic. So let's take a step back. Like as I was working in digital learning and that space, I was really struck by the immense need and potential of health education. And I'm not a doctor, but I care a lot, and I thought if I could do something in this space around with technology to enhance and improve the creation of more healthcare professionals, then that would be a good thing to do. So that's kind of where we came from, and we thought, where could we actually make a difference in this space? And one of the things we saw when we did some work initially at Imperial was that really the clinical training and the ability to develop competences clinically under supervision is something that's really hard to validate, to scale, and to make happen in a new way. And we thought a technology platform could be a solution. So we developed the clinical experience platform, where the notion is how can we create clinical experience that are authentic and blend essentially clinical training in a new way. And what you see here essentially on the right side is a view of the platform where multiple students, learners from anywhere can join a live clinic, as you see above, but also really interact with patient and clinician and the clinical output of, for example, what you see here, a dermatoscope. And do that in a safe and secure way with patient consented. And that's really the kind of that's the platform story. But what we really found is that there is a significant challenge in health education globally, um, ranging from capacity challenges around limited preceptorships and faculty availability, consistency. We found that exposure is uneven across and the supervision quality is variable. And are there ways in which we can improve that? And then connection, logistic and travel barrier often. And our view is really how do we create a connected global workforce, if you will, that learns together to work together. And we thought if you enable a platform to digitally enhance your clinical teaching and learning, you're able to essentially address some of the preceptor set challenges. You can look at rural access when you have a hub and spoke model from clinics to rural clinics and really create global connected clinics. And I want to kind of run you today through the platform itself, but also give you some use cases on how the platform actually works and where the benefits are. I can't see the chat at the moment, so if you are typing anything in the chat or have very urgent point, Vrinda, perhaps you can
Yeah,
raise your hand and let me know if there's
yeah,
something I need to clarify
yeah. I'd let you know.
um, and essentially our aim is to prepare better for practice, be more efficient and effective in clinicals, allow for global collaboration, expand access, and really strengthen the readiness for students to not only, I guess, exams are important. That's a really key driver for many, but at the end of the day, be great practitioners. Um, since we launched the platform about 2 years ago, we have actually developed like a network of smart connected clinics across the UK, but also abroad. So we just started with the University of Virginia around nursing and medicine, but also in the University of Uzhgorod in Ukraine and Pretoria in South Africa. And the clinics that we work with are family and community medicine, cardiology, radiology, audiology, dermatology, surgery, palliative care, and end of life. And I'm very keen to share with you kind of the results there. And now really this idea of international classrooms, so coils or exchanges and electives. For example, what we're doing in Europe with the University of Exeter, connecting GPs across Europe as part of EURACT to learn from each other's clinics, and with the University of Uzhgorod in Ukraine, where there is a great student exchange between students in Ukraine and students in Exeter, for example. Now, what does the platform do? So this is kind of the highlights of the platform, and then I'll deep dive into each element just to show you what that looks like. And there will be a video that actually shows it in action. It's kind of might be helpful. So essentially, the platform is an online platform. You can just access it with the web browser, and allows you to schedule sessions for cohorts, for students, for groups to join clinical sessions. they get a calendar invite and they can join the live clinic. So essentially, if you have a clinic running, whether it's an outpatient clinic, a ward round, or a GP practice, or an operating theater, essentially students join that live clinic in real time and can see what's happening there, but also connect the monitors or the clinical devices. The live clinicals are what's interesting, I think, about it is that what we said is let's take the simulation approach because that's very, very strong. The idea that you have an introduction, then the simulation, and then a debrief to really bring back the learning and connect it to the learning objectives is that we built that into the live clinic. So the students join as an introduction, they have pre-materials, then there's the clinic, and after that, there's a debrief. And it's really interesting to see that if you bring, let's say, 20 or even in some cases, 90 students together around the bedside, there's a different kind of outcome in terms of the way they're learning and the way they're reflecting. And the platform allows for reflection and ties it to kind of learning objectives that you can set essentially as part of the clinic. Then there is also now a recording functionality. So if you can essentially separate module also with regards to consent that allows you to record the clinics for review and use that in your other learning materials. But also what's really interesting is that we found that a lot of clinicians find it really useful in terms of their peer review or their supervisor review of their clinics as part of their portfolio to record their clinics and reflect and get feedback on their actual clinics as part of their portfolio development, CPD, and continuous development work. And then after that, there is also a sign-off and certification module. So we have a lot of data that we can bring up about the students' progress around time on task and allow them to link that to the learning objectives and get a certificate token that they can put in their portfolio. So that's hopefully giving you a kind of a good view of what the platform does. And just to give you kind of what we have received as kind of feedback from the research done on the platform, it's really around capacity, quality, and efficiency gains from using this platform in a blended format. One thing I really need to stress, this is not about replacing clinical time, right? We're not replacing it, but we're augmenting it, really transforming it, and adding a new component to the way you do clinicals in a blended space. And I can go into details how that works in an undergraduate or postgraduate kind of setting. But we see essentially that through the platform, you can have more learners essentially per clinical encounter. What's interesting is that also offers opportunity for multi-professional learning and for joint kind of view on a case and kind of having that common operational picture with a bunch of people rather than one-on-one or one-on-two. In terms of supervision time, it is more efficient because you can run your clinic and all of a sudden you have 20 students kind of with you instead of one or two. And then the student feedback has really been really great. Like they get a lot out of that. And yeah, that's really been kind of a fantastic driver. And some people immediately ask, what did the patient think? And the patients, we've done quite a lot of research on the patient acceptability and what they find, and they're really actually quite happy. And I can talk to you about why. Part of it has to do with the platform offers them a sense of real control, so they can pause at any time, and they kind of like to contribute is what we found. And in a way, as clinicians, the clinicians feel often very protective of the patients, and the patients are actually quite eager to help, and they kind of like this. Um, and yeah, and then the other thing is really this geographical constraints that you can take away with rural clinics or clinics abroad and really bring students together or learners together from all different types of backgrounds. Um, and let me start like deep diving into the platform by just saying that the whole platform is built as a baseline to be safe and secure and compliant with the highest standards. we were set up and validated with NHSE, which is the National Health Service here in the UK. And apart from the security on the technical side, data is securely handled and stored to the highest standard. The platform also has a lot of safety assurances and features. So students cannot switch off their cameras, for example. So they're always on. So when especially in consultation, these patients really value the fact that the students are visible, so they cannot switch off their camera. Clinicians and patients can stop or pause at any time, and the students are still there. The consent is integrated into the workflow, so that's also an important aspect. And all the students, before you can join the platform, you need to take a module in professionalism and ethics to do that. And you basically sign off that you're joining a clinical session every time you join a session. But I think a picture says 1,000 words and a film says 1,000 pictures. So let me show you how it works in action. And this is actually one of the global classrooms that we've done a while back with Professor Alex Harding from Exeter, and he'll show you essentially how the consultation worked from a more kind of technical perspective of using clinical devices in a GP practice setting.
We're constrained at the moment by having 1 or 2 students with us in clinical teaching environments, and we need some way of scaling. The question is, what kind of teaching can we deliver to larger groups of students? So today we did a virtual clinical teaching session with students from across the globe. One of the things that the patient was presenting with today was some discomfort in her ear. Okay, so there's the eardrum there. And as we've said, it looks suspiciously clear of any wax. Looking at this red and slightly excoriated skin around the eardrum, what do you think the diagnosis may be, Celeste?
Inflame?
Yes, inflammation. Yeah, good. And so we call this otitis externa. And that, some ways, that's the best view there. Can you see that red, slightly scaly patch there? It's possible to demonstrate clinical signs and give the students an opportunity to make absolutely sure that they can see the drum, that they can see the bones that lie behind the drum, and it gives us the chance to pause and make sure that everybody is on the same on the same wavelength. All of the students today told me that they hadn't had that opportunity before, and this was the first time as clinical students that they'd seen the inside of a patient's ear under supervision. This is seeing patients in real time. So one of the key skills that medical students and clinicians of all grades need to learn is this ability to reason on your feet in real time. These are my smart glasses, okay? So we're going to be able to have a look at at Susan's feet.
And it still comes back. So it doesn't look anything serious, does it?
My concerns about medical education is that it fails to teach people from different parts of our profession together. Nurses, physicians, doctors, physiotherapists, learning together to solve problems together.
And I wanted to just pause here for a second, get a first set of...
We're restrained at the moment by having 1 or 2 students with...
Sorry. Get some initial responses. One thing I will say is that this is for undergraduate teaching, and in postgraduate, we get a lot of feedback that they really love the deep conversations between patients and clinicians. And we have actually a series on this that with Professor Harding around, for example, difficult conversations with patients or issues with patients, and it's fascinating to see kind of clinicians, seasoned clinicians, having discussions after having seen Alex in this case in practice with a number of patients and reflecting together on the case. So it works across kind of the spectrum, not only in undergraduate, also in postgraduate and continuous education. But let me get some initial feedback. I can deep dive further into the platform for a bit, and then have I have a couple of use cases to show you.
So, Gideon, you want to ask participants any questions or any comments now?
Yeah, I just wondered if there was anything in the chat already that
Yeah.
I could
At the moment, there is nothing, but I'm very happy for anyone to raise their hands and ask the question or any comments regarding what you have seen so far. Yeah, I can see one hand. I think it says GF. Yeah, please. Oh, it's Gemma. Please come in, Gemma.
Hi, Gemma.
Hi there. I'm a dietitian by profession, and then I work at the Exeter University on their advanced clinical practice program. And I was in my dietetic role yesterday with some a dietitian and a podiatrist who were over from Singapore, seeing what we did in the UK in our profession. So watching this, I think it's fantastic. I can see loads of benefits from it, and I think it's absolutely brilliant. It should be involved in as many undergraduate health programs as possible. I've never seen anything like it, and I think it's fantastic.
I really appreciate that. Thanks so much. And you just need a computer and a webcam to get started. So it's like,
yeah, thank you.
Yeah, let me go. That's really a kind comment, and we'd love to know more. But let me deep dive a little bit into the platform, and then we'll get the use cases and have some discussions in addition. Scheduling simple oversight and powerful insights is the idea. So you can essentially schedule your sessions, and you can do it in two ways. You can really allow students to self-register. So you can say, hey, I have these clinics lined up every Monday. I'll see patients, let's say 4 to 6 patients over the course of an hour and a half. Sign up to the sessions that you want to do. And some schools choose to say every student need to choose so many sessions to join throughout the year, and then that is then part of their curriculum. The other way is to say, no, every week or every 2 weeks, we will schedule, or every day, we'll schedule a session for you to join, and you will be put on that session and expected to join this session. So those are the kind of two ways, and all of that is, again, very security is key here. So students cannot join sessions that they're not invited to. So it's really, if you set up an open session, so to speak, it's not really open. It's only open to the students that are selected to be able to join those sessions. And you cannot share a link. You cannot you cannot access the platform unless it's absolutely you. That's really important. And you can essentially track this against the learning learning objectives. And it can be EPAs, it can be competences, it can be learning objectives, depending on your curricular structure. Then you have the live clinical piece, and that's really about live patient. And the baseline is essentially you can run this with a camera. But what we find is that clinicians sometimes like to add another camera view. So you have a view of the patient and the clinician, and you have maybe a close-up view of the patient. And students can zoom in and out of the different views, and you can have 4 views at the same time. So for example, here you can see a sonography machine connected to the platform, so students can kind of see the live sonography machine, but also see the patient interaction at the same time. And they can have a camera on the hand movement, so they can see really how the clinician is manipulating the ultrasound probe, essentially, with the patient. And that's really quite effective as a preparation for practice and really going deep in certain cases with a larger group of students. Yeah, so that I think gives you a view of what the live component of the platform does. Again, then there's the opportunity to record. So again, separate consent, separate module. This is very important for us to constantly note that security and safety is absolutely paramount. So the platform element that you saw just now is separate from this recording, but it can be unlocked essentially for the for use as part of the platform kind of package. And this allows you to either record the session for students and allow them to reflect and use that in learning materials, or it allows you as a clinician to record yourself in a clinical environment and get your reflections, but also get others to reflect together with you as part of your portfolios process. So those are the two ways in which recording can be used. And then finally, sign off and certificate. You join a session, there's an attendance monitoring. You can you can request a certificate, and you have your reflection kind of page where you can note your reflections and then you can review them afterwards. So that's the kind of what do you call it? If you want, what we're trying to do is really close the learning loop around clinical teaching and learning. And again, this sits next to your clinical your actual hands-on clinical training, and the combination is extremely powerful, we find.
Gideon, there are
Yes.
many questions
Oh,
coming in.
great.
So shall we go through the questions before you move on?
Yes, let's do that.
Yeah. Okay. The first question is from Argita Zali. I hope I'm saying their name correctly. If not, my apologies. So they have asked that I have a couple of questions. You mentioned that students should keep their cameras on.
Yes.
Have you considered how this might impact neurodiverse students who may find that challenging? Secondly, how does the platform ensure a personalized learning experience? And finally, what policies or safeguards are in place if students behave unprofessionally or say something inappropriate during a session? So there are 3 questions for you.
Yeah, let me start with the first one around kind of accessibility. So the platform is obviously built within kind of the confines of a digital environment of the standards of accessibility and et cetera. But it's an interesting question around neurodiverse, and it really depends in which stage of learning they are and how you want to organize it around them. But it's really so what we find is that, especially in undergraduate teaching, a lot of the schools choose to have students join in groups in a room. So you always offer, also for equity purposes, the opportunity for students to come into campus or join from the clinic where they are learning the clinic. So that's one way around it. So let's say you sit in a classroom around the screen or around and we actually have one institution who actually set up specific campus clinics to view. So it has a curtain. You come in with a group of like 15 students or 8 students or 20 students, and you basically join the clinical classroom, if you will. And that's a way potentially of solving that. And I think at the same time, it's actually what we also hear from students is that they really appreciate the fact that they can join, even if they have to be visible. It's a safe way into clinicals, especially if you're doing early years, for example, the year 1 and year 2s. If you're going to send them into the community, this is actually a very good way of kind of socializing to them into the environment before you actually send them out, which can actually be a benefit to a lot of students who, a lot of them do have anxiety, and it does take some courage, I guess, to join actual clinicals in this way. And this offers, in a way, a safe environment to do that together under supervision. Second question around personalization. So the students can obviously do their reflection in a personalized way. The platform, if you join individually, you can actually select which stream you're going to focus on. And I think also from a learning design perspective, the clinician can really set the rules at the start, or the supervisor or the instructional design team, depends a little bit on how you're organized, to say to students, well, you will see this clinic. I would like each and every one of you to do X, Y, Z during the clinic. I will ask some people to participate more actively. There's all kinds of things you can do to make it a personalized journey. And then in the interaction with the patient views and the reflection, I think there's a lot of opportunity to really create that personalized experience. And also with the self-recording, really showing how you're doing things yourself. in different ways is another way in which the platform supports that. And then finally, around safety and student behavior, uh, the platform, again, you have the before students can access the platform, they need to take the values and behaviors course. It's made very clear that this is the same standard that they're held on as they're held when they're in real clinic, in live clinic. You can refuse and take students out at any time if they are not behaving according to the way they should. If they do switch off their camera, for example, they're just going to put on hold and going to be put out if they don't turn it on quickly, essentially. Um, and it's really the patient and clinician who are in charge of the session, essentially. And if students, and we haven't seen any of that, actually students, the experience is that students sit on the edge of their seat because this is real clinics. This is not a simulated, there is something about real clinics that is different from a simulator. And I think that really is, there is some magic there that we see, and students really behave in a very, very good way. But let's say they won't. Well, the consequences are the same consequences as in real clinical practice.
Yeah, thank you, Gideon. Again, the next question is, how about the medical education skills needed for the clinicians? What training or what do they need to get ready for this?
So I'll come to that later, but essentially, the platform is quite intuitive. It's quite easy to learn how to use it. But again, it depends. If you have so many variety, but the baseline is, and we provide training for clinicians on that, depending on when we meet them. But there's a lot of training material. The baseline is, if you can, is to learn how to do good video calling, which includes kind of share screen, understanding how you manage sound settings and your camera. And that's something that we really spend a lot of time making really easy for clinicians to use, because we want this to be as seamless as possible. And then there's more advanced kind of things around using multiple cameras, how you set that up. We have a ton of material to support that. And then there's a lot of experience in kind of how the sessions could be run from a more pedagogy perspective, right? Like, how do you get most out of the learning journey? And how do you make sure that we're really linking it to the learning objectives and are able to give the right feedback, and the system really supports clinician in doing that. But if you can essentially use a web browser and you can start any web-based system, then you should be fine.
Yeah. A few more. These are teaching clinics. How long does each patient encounter take? And also, how about the specialist equipment needed for such a clinic?
Yeah. So the sessions really depend on the clinic, I guess, right? So if you have an outpatient clinic or a GP practice space, then we usually see sessions last between an hour and 2 hours, where they see between 4 to 10 patients. Sometimes less, depends again on the type of case and the thing that you want to do. But what we really want to kind of get to is that you're teaching in the flow of your work, essentially, but really provide enough structure to really get that that reinforced learning as part of that. And again, we can speak to various kind of levels of training and how people are joining and how you structure it, but that's the bottom line of it. And then the second question was
whether any specialist equipment. I think some hardware is required, is it not? The kind of glasses, etc.
Yeah, so let me be absolutely clear around the equipment. You don't need any specialist equipment. If you have a webcam, you can get started with the platform. And we actually advise that now. We started actually, and this is a bit of the history of how we developed as an organization, is that we thought, oh, that's super nice. We have the smart glass, we have all this fantastic devices that can connect. But actually, we now come to the conclusions to say what's the baseline to get a good session is essentially a webcam, maybe another one to connect. And if you can connect 2 webcams into your computer, you can start going. We do have a set of recommended hardware that will optimize your sound, and we can help you with kind of making the section look even better. But that's small stuff that you can really do yourself, and we're very keen to support that. When it comes to the clinical devices, the otoscope and the dermatoscope and the stethoscope are pretty much plug and play. You just click them into USB and they start on the platform. So that's not a lot of effort. You will need to buy those because they're electronic. But our platform is agnostic. So if you have any e-stethoscope or the dermatoscope, for example, as long as it has a feed, we can connect it to the platform. Sonography machine are just coupled into the platform. The normal technician part, you have this in any, there's absolutely not a problem. Also microscopy from Zeiss, they all connected to the platform. It's pretty standard connector into the computer. The smart glasses, again, with the right use cases, if you're doing specific examination, mostly in operating theaters, they're quite useful to get that first person view. Um, those uh, those uh, those can be bought. They're and the main thing there is to make sure that they're connected to the Wi-Fi, and that requires work on the IT front, not on the IT front, but more on the connectivity front in the trusts or in the hospital. But you absolutely don't need that to run great sessions and get value out of the platform. Essentially, if you have access to the platform and a webcam, you can get going.
Yeah, Gideon, there are some fantastic questions. Maybe you can answer them quickly. Is it possible to apply this approach to diagnostic laboratory, like processing patient samples? Can we teach like the diagnostic tools
Oh,
through?
fantastic question. Actually, we're this has come up in the we haven't thought about that, but this
Yeah,
actually came up last week when we were
yeah.
speaking with the biomedical science groups who said actually this would work fantastic in that setting. And the answer is absolutely yes, because you can easily share your screen, you can share your results, and you can give a real view of the various machines that are operated and draw the conclusions.
Yeah, thank you. And I think Asad Malik has asked three questions. I think two of them maybe you have already answered about clinician suitability and training that you have already mentioned. How interactive will the students be during these consultations? I think that's also has been touched upon. The last question is, the assumption is that English will be the primary language of communication. How will be reduce cultural inertia or preventing Eurocentric values dominating? So have you tried any other languages here?
Yeah, so the platform actually, we one example, and we're doing that at the moment, is around Ukrainian and English, right? So we have a Ukrainian clinic, and the patients don't speak English. So, but we have students in the UK who would like to understand what the clinic is about, and we have a live caption and translation service that we're now. Again, it's part of the platform as a standard, but in this particular case, Ukrainian is not a standard language for live translation. And we found a solution for that we're testing. So it's very important for us to really make sure that the platform is localized. And
Yeah.
that the nice thing about the question is that the platform is really built to, from my perspective, it's like how do we create equity in also the kind of sharing of sessions, right? So we want to kind of make sure that there is a sharing in both ways when we create these global experiences. And that's really what students and the teachers value. And that's where, from a technical perspective, the live translation and captioning and ability to do that with zero friction is really, really important.
Yeah, couple of questions about global recognition of professional qualification, whether this can be used for global teaching and the kind of exams practice in the profession, whether it can be used for that purpose. And the second one, whether this platform is open for registration subscription from all around the world. What about the case variability? I mean, do you use multiple centers to provide a wide variety of clinical cases? So three questions related to application at the global level.
Yeah. So for exam prep, absolutely. So you can either schedule sessions that have specific attributes that focus on the exam elements that the students in terms of prep. But you can also do remote and reversed OSCEs and remote supervision through the platform. So let's say you are in a rural, one of the things is you want to supervise clinicians in a rural clinic or students in a rural clinic and QA that site where you have where you don't, for example, have a PhD level training facilities. You can do that from a hub where there is that training supervision, and then you can essentially allow that model to work in that way, and that saves a lot of time and effort and coordination and travel. So and the other way is that you can do remote OSCEs. So if you have students and actually live and see kind of students live interact with patients remotely, depends again on what level they are and how they are supervised and in what kind of setting you want them to operate. But one of the key things that we're now working on, and this is especially interesting in countries that have vast amount of terrain where you really want to help build the workforce locally, and this kind of our vision and how we want to kind of work on this further is this hub and spoke model where you can imagine a program like a new medical or a health care program where students in remote areas in local clinics are actually trained up and learn in those local clinics and only so often come to a central university hub to do hands-on seminar work for short bursts of time and then go back and really learn in that clinic. And the platform supports that remote supervision and connectivity between the students as they are learning and working in their local environment. And that's something that I think is really interesting to kind of think about.
Yeah, thank you. I'll hand over it back to you. It's all questions done now.
Okay, thank you. Great question. So let me give you some examples of how it works in practice. So this is an example of interprofessional learning where you can really scale the number of students in a very confined room, but also allow different students to come together in a virtual way. And that's one case study, right? In this case, in radiography. The second case was really, and this is really one that is close to my heart that I didn't see coming in a way, is our work in hospice care. It's very hard to get students in hospice and really get them to experience that process, whether it's outpatients or inpatient processes of end of life. And we provided access to this clinic. We have one clinic that really likes this, and the patients absolutely loved doing this, both outpatients and inpatients. And we had students from very different parts of the country joining, and it's not only great for the students, it's also great for the patients. The patients were actually quite telling their family members how wonderful it was to speak with students with a strange accent from another part of the country, which they wouldn't imagine being able to do. And we always thought that patients would not want to do this in their, people in their end of life, they might not want to have 20 students coming into their room, but actually in a virtual way, they really they value it, and they kind of want to give back. And this is a nice way of allowing that to happen. And we just know that there's a big gap in exposure to this type of placements. So I wanted to give that example. The other is really around the efficiency and effectiveness. So really the ability to save time if you augment kind of your placement schedule in half a day a week, essentially over the course of your placement. It saves essentially 6 clinician days per student in terms of your teaching and learning capability. And that's really an efficiency value. Plus, the fact that the platform really drives home the learning in the way that you want that. So that blended approach, I think, has multiple benefits. And I think this is a really strong way of showing not only that it does well from a learning perspective, but it's also great from a clinician perspective who is under pressure. You need to get your patient load through. you have all these students, there's more pressure on the system to accept more students, and we want to kind of make sure that they're getting what they need to be getting. And this is a way of augmenting that. And then this was raised before, again, remote QA validation and assessment as part of the question. So one of the pilots we're doing right now is in emergency palliative care, where it's very hard to get students in time at that stage. And you're enabling essentially students to join and be assessed in that way. And then finally, getting started with VCE. As I said, it is a browser-based platform, so it runs from any web browser. You only need a laptop and a camera to get started. Consent materials are provided, including patient video. Compliance ready, we have all the documentation. You know, if you want to use this, you have a data protection. Often you need kind of approval processes internally in the clinic or in the school. We've done this many times, and there's a lot of documentation that we can hand over to make that process work. And that's really been part and parcel of the way we deliver. And institution essentially can receive admin and clinician accounts to start scheduling sessions immediately. The training is quite light to start with, but it's good to kind of build it up. Walk before you can run is what we now really say using the platform. And yeah, we'd love to hear your thoughts and see what you think.
Thank you, Gideon. There are a few more questions I can read for you. Gordon says, this is a fascinating tool for advancing equity in education. I have a question about the case follow-up. Does the encounter end with the initial visit, or do students have an opportunity to follow the case through? Often additional diagnostics prevent us from fully completing the case and initiating therapy.
Yeah, I think that's a great question. And I think it's a curricular design question, really. Is what we find is that so the answer is you can definitely follow the case through, but you have to still make that scheduling work. So, but this is me taking a step back, regardless of the platform. What I've seen then in curricula, the discussion being is, can we actually define a couple of cases that students follow through longitudinal throughout the system as they train, and link clinical sessions to those kind of patient cases that are the longitudinal in the curriculum, and make sure that they hit the kind of stages in that life cycle of the patient. So that's kind of the meta answer. In terms of practice, if so, clinicians do know their patient population, especially this is where family medicine is really interesting, because they know the patients well often, and they can, if they have a good relationship, they can ask them to come back and schedule the sessions and offer that to the students to sign in and see the follow-on, essentially. So you can basically, if you've seen a patient and you want the students to join the patient in 5 weeks, you can say, hey, in 5 weeks, I have a clinic. The students that were in that clinic, I'm going to invite them again. They can sign up if they have time to meet that patient, and that way you can do that on the platform.
Yeah, thank you. I think another question is also interesting here, whether we can include this technology in work experience, helping to inspire next generation of healthcare professionals through raising awareness of global healthcare. Accommodating work experience in healthcare setting is a real challenge in the UK in terms of capacity. This could provide an exciting addition, perhaps. So do you have any experience with that?
We haven't done it. I think it'll be great. It'll be yeah, I think it shouldn't be a problem. We just need to make sure that the students that join, because usually students go through BDS, and they, you know, when they're joining a medical program, they're on the program as medical professionals. So if we're going to get students who are not yet there, we need to make sure that it's consented and the patients are happy with that, and maybe have selected patients. But I think it is a great idea.
Thank you. Finally, I think the most important question, what's the cost to use the platform for a medical school, please?
Oh, fantastic. Well, it depends on the number of students and the number of clinics, but it starts with £5 per month. So it's
£5 per month.
yeah.
Wow. Okay. Thank you. And yeah, there are lots of positive comments there. Thank you for this presentation. It's great to see how technology is not just enhancing medical education, but also shaping the more connected and adaptive healthcare professional. That's fantastic. We still have 8 minutes. If anyone is interested to raise their hand and have some comments or questions for Gideon. Vinny, yeah, please come in. Yeah. Come in, Vinny.
Yeah. Hi. Thanks so much for an exciting talk this morning, Gideon. I'm part of the Supporting Palestine Higher Education Working Group at the University of Exeter. And there has been a lot of interest and requests from staff from Gaza about joining virtual education in UK because of the war. You know, they haven't had access to clinics and things, and they wanted students or staff to be able to join any virtual sessions. And you were explaining this and saying how this was used in Ukraine. I wonder if and how they can key in through the university as part of what you did with the university in Ukraine. Is it possible?
I think if you have the sessions scheduled and you have an agreement and you invite students from wherever to join the session, that's absolutely fine. There's no limit to who and how you can invite students, depending on your own internal kind of agreements and processes. So the platform enables that essentially, and students do need an internet connection that works, right? That's a minimum requirement. The platform automatically tests and tells a student if they can or cannot join, right? So it's very clear to the students that they have good connectivity or not. But if that's sorted, it doesn't require a lot, but it's a base to work.
Thank you.
Right. Thank you.
Yeah. I remember you mentioning that you have some very good connections with South Africa, but are there any other global South countries where this technology has been applied and taken up by professionals there?
Not at the moment. We're
Okay.
keen to expand, but we're really focusing at the moment on our current kind of footprint. But we're at the stage where we're looking, hey, who has ideas of how we can use this together?
Yeah, that's very helpful. Thank you. Are there any publications? That's a question in the chat.
Absolutely. Yes. So everything we do is evidence-based. We want to also add constantly to the evidence. There are a couple of papers that have been published and a number under peer review. And we can share them. They're also on the website, I think should be.
Yeah.
So
the website, and if you can add your email address, that also would be helpful. Yeah. And then question is, how many students can join a session at the same time? Is there any maximum number?
Yeah, so we can have up to 20 students visible and live. That's kind of the upper limit of that visible. But the way, if you want to expand on that, there are two ways. One is you have more students in a classroom, so you can have up to 20 classrooms essentially join. So that's a way of adding more students. And the other way is we also have an observer role. Then the students are not visible to the patient and the clinician. If that's okay, and it depends again on the setting, then you can have up to 250 students joining a session individually.
And it looks like these sessions are applied mostly to clinical settings, but have you had any interest in doing this, for example, anatomy dissection or anything like that?
Anyone can use it in the way that they see fit, essentially, and I think it'll be it's absolutely possible.
Yeah, because something that like cadaver dissection is not available everywhere, but something to bring that into the classroom would be fantastic.
Absolutely, and then you can record it and also reuse it. That's kind of do an abdominal dissection.
Yeah. No, thank you, Gideon. It's really a very interesting topic, and I can see that there were so many questions here, which really bring so much of discussion, which was very fantastic. And we have recorded this session and we'll